Sexually transmitted diseases, or STD, spreads from one individual to another via sexual intercourse. Vaginal, oral, and anal sex is the most common forms of contact. However, they can occasionally transmit via other intimate physical contact. Sexual intercourse is proven to transfer more than 30 different germs, viruses, and parasites. 8 of these viruses have been associated to the highest rates of sexually transmitted illnesses. On the other hand, 4 of these 8 infections are presently treatable.
On the year 2016, there are 988,000 expectant mothers that are diagnosed with syphilis, leading approximately 350,000 poor birth outcomes, including 200,000 miscarriages and neonatal deaths. Addition to that, in certain circumstances, STIs can cause severe reproductive health implications that go beyond the virus itself, such as infertility or mother-to-child transmission.
Moreover, it is reported that around 500 million individuals is suffering from herpes simplex virus genital infection, and there is 290 million females are diagnosed with the human papilloma virus. The preponderance of STIs has no or just mild manifestations that may go undetected. STIs including the HSV type 2 and syphilis can alleviate the chance of getting HIV.
According to World Health Organization, each day, more than 1 million sexually transmitted illnesses are transmitted worldwide. And every year, an estimated 376 million individuals become infected with one of the 4 sexually transmitted viruses, which are chlamydia, gonorrhea, syphilis, or trichomoniasis.
Furthermore, according to the report of gonococcal antimicrobial resistance surveillance program, there is a high prevalence of quinolone resistance, rising azithromycin resistance, and increasing resistance to extended spectrum cephalosporins. Drug resistance, primarily for gonorrhea, is a serious challenge to lowering the global impact of sexually transmitted infections.
Because of the rampant spreading of STIs around the world, it is important for all of us to have wide knowledge and better understanding on this kind of health issues. So here are some ways to prevent STIs or sexually transmitted infections. First preventive measures that we can do is the counseling and behavioral treatments, which includes the initial prevention against STIs like HIV, along with the unplanned pregnancies. We can also do the following preventive measures such as: first, comprehensive sexuality education, STI and HIV pre- and post-test counseling. Second, safer sex or risk reduction counseling and condom promotion. And third, STI interventions targeted to populations such as sex workers, men who have sex with men, and people who inject the drugs.
STI prevention, education, and counseling tailored to the needs of adolescents. Besides that, counseling can enhance people's capacity to distinguish the signs of sexually transmitted infections, increasing the probability that they would seek help or convince a sexual partner to do so. Prevention is better than cure. People shouldn't feel ashamed in wanting to have an additional knowledge about sex, because this will help them to lessen the risk of getting infected by this kind of infectious diseases.
In the year 2020, it was reported that the number of newly confirmed HIV-positive individuals has reached 2,818 in the Philippines.
In addition to that, 94% of the newly diagnosed were male. Meanwhile, almost half the cases were 25 to 34 years old, and 30% were 15 to 24 years old at the time of diagnosis.
All this data proves that responsible sexual behavior is socially desirable and deliberate patterns of behavior used to promote sexual health, manage risk, and foster respect for sexual partners within the context of community influences.
To point out, we have to know the opposite of responsible sexual behavior so that we know how to avoid. A few examples of irresponsible behavior include sex without protection, then second, multiple sexual partners and not using protection for each of them, Then, third, not using contraception to avoid unwanted pregnancy. Fourth, having sex for wrong reasons like peer pressure, pressure from a partner, and sex as a way to keep someone. Then, having sex without understanding the risk. And lastly, not wanting to learn about safer sex.
Now, learning to be responsible with our sexual behavior is a must because it impacts our future. Sexual behavior plays an important role in our future. When we engage in more responsible sexual behavior, like using dual contraception such as condom and birth control pill, we can plan our future better. Even if we don't want a baby, responsible sexual behavior gives us the option to decide when the right time is.
Not only that, responsible sexual behavior can also improve our sexual relationship. Being sexually responsible shows how trustworthy you are as a partner. It also means that you know more about sex, such as treating your sexual partners equally, making sure your sexual intercourse are consensual. Third, knowing how to use protection properly. This guarantees that you are having a better sex, that you are more responsible partner to be with overall.
Finally, a responsible sexual behavior gives us more control over our body. Deciding to have a responsible sex is a decision that you make to protect yourself. How empowering it is when all the important decisions about your body are made by you. Whether you make a decision about your body that you know will affect your future, you make an empowering decision. In conclusion, do not feel bad about wanting to learn more about safe sex or wanting to know how you can behave more responsibly.
Because sex is part of everyone's life at some point, so knowing how to do it responsibly every time is never a bad thing.
Furthermore, abstinence from vaginal, oral, and anal intercourse is the only 100% effective way to prevent HIV, other STDs, and pregnancy.